Hello and welcome to In Depth, the show that brings you a comprehensive view on various subjects. I'm Frank Pereira. The Ministry of Health and Family Welfare has proposed to amend the Drugs and Cosmetics Act of 1940. The idea is to bring stem cells and cell-based products under legal regulations. Scientists have been seeking this for a long time because of its potential for misuse and danger of exploitative stem cell treatments that are used on unsuspecting patients even before they are evaluated and proved fit to be used. The government has now said that stem cells and products that are substantially altered will be treated as a drug and will have to seek the regulator's approval before being marketed. Let us consider what this means for stem cell research, how it will help patients, and above all, what is stem cell therapy and what can it do? When we fall ill or get injured, the cells in our body are either damaged or they die. When that happens, stem cells inside our bodies become active. They take the place of these damaged cells and cure them, which is why scientists consider research into stem cells basic to our understanding of the healing processes of the body.
Cells are the basic building blocks of living things. The human body is composed of trillions of them. They provide structure to the body, convert nutrients from food into energy. They also carry out many other specialized functions. Cells contain the body's hereditary material and make copies of themselves. Cells have many parts, each with a different function. Some of them are specialized structures that perform certain tasks. Among a million cells in the human body are some unique ones known as stem cells. A stem cell is an undifferentiated cell with a remarkable potential to develop into many different cell types during early life and growth.
Stem cell is basically the mother cell of the body, and it has the capability to grow into any type of body cell. Any type means we are made of stem cells. And that is in our bone marrows, long bones, and they are in plenty. These are the cells which make blood for us, which do all the repair for us, so that it controls the growth, it blocks the deterioration.
Stem cells play a huge role in the body's healing process. They include embryonic stem cells that exist at the earliest stages of development, and various types of tissue-specific or adult stem cells that appear during fetal development and remain in our bodies throughout life. For example, if any part of the body gets damaged or ruptured due to accident or illness, then stem cells deposited in stem cell bank can be prepared in a laboratory to cure the damaged part. Laboratory studies of stem cells enable scientists to learn about the cell's essential properties and how they can be used for healthcare. Stem cells can cure several illnesses like cancer, diabetes, heart and arterial related diseases, blood related diseases, mental illness, cornea, Alzheimer's, illness related to bone structure.
So stem cells now can be procured from some parts of the body, let's say sometimes the blood or the adipose tissue in the abdomen, to make the stem cells, to actually procure the stem cells, to process them out of the cells and then use them to repair certain diseases or to treat certain diseases.
Realizing the importance of stem cells, the Ministry of Health and Family Welfare proposed to amend the Drugs and Cosmetics Act 1940. It aims to bring stem cells and cell-based products under legal regulations. The ministry also defined a category of stem cells and their derivatives that will be termed a drug. These cells will have to follow protocols mandated for any drug development. According to the government, stem cells and products that are substantially altered, amounting to a change in biological characteristics, will be treated as a drug. They will have to seek the regulator's approval before being brought to the market. Bureau Report, Rajya Sabha TV.
Well, several types of diseases are treated these days using stem cells. Stem cell therapy in itself is a unique medical practice. Today, it is indispensable in treating more than 60 incurable diseases. Let's consider what its benefits are.
Stem cells can treat a wide range of diseases. For the past several years, they have been used to cure serious diseases. Diseases once considered incurable can be treated using stem cells. Actually, human leukocyte antigen or HLA system is a gene complex in humans. HLA genes match in same family members. Sick people can be cured using stem cells of any family member. And now with advancement in science and technology, it is possible to freeze and preserve these precious cells for decades without losing their healing ability.
Diseases in which otherwise there is not much advancement in terms of treating the patient, stem cells has a possible potential. From certain parts of the body, we procure some cells. Then we process them in some machinery, and there is a defined process in which we take out only the stem cells. And those stem cells we put back into the places where the disease is.
Since stem cells can turn into various other types of cells, scientists believe they can be used to treat and understand diseases. Stem cell therapy is also being widely used in the treatment of multiple sclerosis. With the help of stem cells, it is possible to treat diseases related to liver, kidney, Alzheimer's, Parkinson's disease, acute leukemia, chronic leukemia, heart disease, diabetes, spinal cord injury, autism, and various types of cancers. It is also possible to treat, repair or replace damaged organs through stem cell therapy. Artificial limbs can also be grown with the help of stem cells.
It is basically Rampant. Any problem, you take stem cells, it will help you. May not be 50%, maybe 10%. So wherever doctor feels that okay, this patient I have nothing to do, ये patient को हम फायदा नहीं दे सकते, and maybe it is not going to help this patient at all. So so this is the treatment.
Stem cell therapy is the use of stem cells to treat or prevent a disease or condition. Under this, stem cells are implanted in the patient's body for treatment. These days, most stem cell therapies are being used to treat cancer. Bone marrow transplant is the most widely used stem cell therapy. It is done in two ways. One is through autologous stem cell transplant and other is through allogenic stem cell transplant. In autologous transplants, stem cells are collected from the patient themselves, harvested, frozen and stored, then given back to the patient after intensive therapy. Whereas in an allogenic transplant, stem cells are collected from a matching donor and transplanted into the patient to suppress the disease and restore the patient's immune system. Stem cell therapy also allows researchers to study the developmental stages that cannot be known directly through the human embryo and can be used in the treatment of many birth defects, infertility problems and also pregnancy loss. Bureau Report, Rajya Sabha Television.
Well, our changing lifestyles are exposing us to attacks by new viruses. There's a possibility that the coming days could see an increase in the number of diseases. In such a scenario, the world is looking at stem cell therapy with great hope. Let's find out what is stem cell treatment and how is it carried out.
This is an 18-week embryo whose hands, legs, head and ears have developed. But 18 weeks ago, it was like this. It is unbelievable that the entire embryo has formed from a single cell, and after 9 months, it will be born as a baby. This is the story of all of us, and the story starts with a cell, the very basis of the stem cell treatment.
See, stem cells in layman language are mother cells, the cells from which all the other cells of the body are differentiated to form different parts of the body. Okay, when the embryo is growing, when the baby is growing. So stem cells now can be procured from some parts of the body, let's say sometimes the blood or the adipose tissue in the abdomen, to make the stem cells, to actually procure the stem cells, to process them out of those cells and then use them to repair certain diseases or to treat certain diseases. So it is of a lot of value in some nervous system diseases, like there is cerebral palsy in children, which otherwise doesn't have too much treatment, is only functional treatment like physiotherapy and occupational therapy. So in that stem cells has a lot of role.
For stem cell treatment, the cells that are used include those that can divide and produce more stem cells, and in some exceptional circumstances take the form of mature cells too. Scientists have divided stem cells into 4 classes. Totipotent stem cells that develop into cells that make up all the cells in an embryo and fetus. Multipotent stem cells can give rise to multiple types of cells, but all within a particular tissue, organ, or physiological system. They include blood-forming stem cells and bone marrow cells. Pluripotent stem cells can give rise to any type of cell in the body. Unipotent stem cells can self-renew as well as give rise to a single mature cell type.
Like neurogenic problems, Parkinsonism or spinal damage or nerve damage, it is excellent. They are doing it as a routine therapy. So in India now also we expect that it will be started.
The basic method of stem cell treatment is to implant them in malfunctioning organs, after which the stem cells multiply and start working like healthy and mature cells of that organ. It's just like our liver, which heals itself and doesn't require stem cell. But there are also certain limitations. In the case of blood cancer, bone marrow transplant is done, which works like a stem cell. But it is important that the donor's gene profile matches with that of a patient. In such cases, patients' relatives become donors. Stem cell therapy can be used to fight diseases like cancer to Alzheimer's, but it is a controversial subject. Like embryo cells are formed through artificial fertilization of sperms and eggs, which are later destroyed for treatment, some people also called it feticide. Scientists are also talking about human cloning from stem cells, which is also a matter of debate. Although there have been concerns over stem cells, but with the passage of time, people are understanding its benefits. Bureau Report, Rajya Sabha TV.
It's time for a short break now, but our program on stem cells will continue on the other side. Stay tuned. We'll be right back.
Hello and welcome to Security Scan. I am Vishal Dahiya, and this week we will discuss the new vistas in the defense production sector in India.
Core technology. It never comes to you. You have to put in the research and put in the money, put in the effort.
We have to create that ecosystem for primary research.
We can make it a buyer's market. And technology transfer should be one of the preconditions.
यही रास्ता है तेरा, तूने अब जाना है। हाँ यही सपना है तेरा, तूने पहचाना है। तुझे अब ये दिखाना है।
Enrolled as Cadet Number 1, Major Priya Jingan became the first woman cadet to join the Indian Army in 1992, an era where people were not used to seeing women in olive green uniform marching along with men cadets. Priya broke stereotypes, made officers more sensitive towards women, and also helped them prescribe standards for women in the army. Major Priya, who's currently working at Lawrence School, Sanawar, is waiting to see the day when women occupy the top posts in the army. She has been honoured with the First Lady Award by the President of India in 2018.
Welcome back. You're watching In Depth on Rajya Sabha television. Many hospitals in India claim treatment through stem cell therapy. Stem cell banks are a booming business in India and charge 5 to 10,000 rupees annually. But the question is whether all this is happening under the purview of law.
Research on stem cells has been going on for decades, but it has also had its fair share of controversy. In 1998, American scientists isolated human embryonic stem cells and invented the technique to develop them separately. But then US President George Bush banned further research, believing that the embryo also had life, which made it unethical to be used in such a way. Such restrictions ended during Barack Obama's rule. Western countries have strict rules on the use of embryonic stem cells for treatment. However, no such restrictions exist in India, due to which terminally ill patients from the US and European countries are coming to India for treatment.
Stem cell research is happening in many countries, and for certain diseases it's used in many countries as well. Like in the US, it's in a lot of research, both even in South America it's in a lot of research, and people have had breakthroughs in that. In India also it is in research, but the process is very dynamic right now. Like even the amendments, the legality of it is changing every day. Like just last week on the 4th of April there was an amendment by the government.
An absence of strict rules, affordable treatments and availability of subjects has made India a hub for clinical trials. By 2011, just over 20 government and non-governmental research institutes were allowed to do stem cell research in India. But the absence of laws on the matter enabled many other hospitals and doctors to work in the field. Many hospitals and clinics now claim to provide treatment facilities in neurology, cardiology and reproduction. In fact, however, bone marrow transplant is the only tested treatment allowed by the Indian Council of Medical Research. Steps have been taken to stop illegal and unsafe use of stem cell therapy. The ICMR released guidelines on stem cell research and therapy in 2007. Similar guidelines were released in 2012-13 and in 2017. ICMR and the Department of Biotechnology jointly released new guidelines that lay down a monitoring mechanism for clinical research and product development, procurement of gametes, embryos, and somatic cells to derive and propagate, bank, and distribute stem cell lines. Other areas like international collaboration, exchange of cell lines, and education for stakeholders and advertisement. These guidelines have no legal provisions to guard against violation. The debate, however, continues on whether it is ethical to use clinically untested methods on patients, but the government is taking steps. Following the online trial registry to monitor stem cell research, steps are being taken to turn these guidelines into law. Preparations are also underway to monitor stem cell therapy and bring it under the purview of drugs. It is likely that a bill may be introduced in Parliament on stem cell therapy soon. Bureau Report, Rajya Sabha TV.
Well, stem cell is a popular method for curing many diseases in the current scenario, and its history is equally interesting. After nearly 200 years of research, scientists developed these stem cells. Let's take a look at the evolution of stem cell therapy.
Stem cells have an interesting history. In the early 19th century, it was found that some cells are capable of creating life while some can generate other cells. In the early 20th century, in an effort to fertilize egg outside the human body, it was found that some cells can produce blood cells. After this, continuous research was conducted. In 1960, research by Canadian scientists Ernest A. McCulloch and James E. Tills discovered embryonic, adult and cord blood cells.
The research and the administration of stem cells is say about 10-15 years old, and the more and more research is happening now in the last few years, and I think the future of stem cell therapy is very, very promising, and it is surely going to have a future in which many diseases will be we should be able to give them good results and good prognosis in diseases where otherwise science has not been able to give positive results.
The first bone marrow transplant was successfully done in 1968. In 1978, stem cells were discovered in human blood cells. In 1981, in vitro stem line was developed for rats. In 1988, embryonic stem cell line was developed from a hamster, after which fetus stem cell line was first taken from a primate in 1995. In 1997, cloned sheep was formed using stem cells, and in the same year, scientists found hematopoietic stem cells, which is a cause of cancer-like diseases.
Stem cell banking is happening for about 40 years now. Cord blood preservation. It's happening, but people, it's hope against hope,
In 1998, Professor Thompson of the University of Wisconsin, USA, separated embryonic cells from other cells and developed a new embryonic cell line. In the same year, Professor John D. Gerhardt of the Hopkins University extracted cells from embryonic tissues and developed pluripotent stem cell lines. In 1999 and 2000, scientists discovered by manipulating tissues of adult rats, they could produce many different cells, which meant cell nerve and liver cells could be produced using bone marrow. These discoveries were exciting, and today these stem cells are curing incurable diseases. In 2012, British scientist John B. Garden and Japanese scientist Shinya Yamanaka were awarded the Nobel Prize in Medicine for their work on stem cells. They received the award for their discovery that mature cells can be reprogrammed to become pluripotent. Bureau Report, Rajya Sabha TV.
Well, that's it on this edition of In Depth, but we'll be back again same time tomorrow with another informative episode. Until then, keep watching Rajya Sabha Television.